So you watched a couple videos about Andrew Yang on the internet, yet you're not entirely sure what his stance on the healthcare industry is. Well, fortunately, you've come to the right video, because in this video today, I'm going to be explaining to you Andrew Yang's version of Medicare for All in the simplest way possible. So if that sounds interesting to you, keep on watching. Also, smash the like button if you want to support my channel. Hey, what's going on, everyone? Welcome to the channel. My name is Tyler. I make videos about college, career, and Andrew Yang, and today I'm going to be explaining to you Andrew Yang's Medicare for All proposal. So just as a note, this is a completely unbiased video I'm going to be making. Yes, I am a big supporter of Andrew Yang, but I'm literally just going to lay down the facts and what his proposal is. So without further ado, let's get into it. So when it comes to reforming healthcare, and really more specifically Medicare for All, there are two big topics that should be discussed. First one being the public versus private discussion. Now, this pretty much gets all the buzz and pretty much everyone likes to talk about this and really debate it. However, there's another underlying topic being the payment model to these doctors, or the incentives for the doctors in the healthcare industry as a whole. Now, this gets almost no attention, or far less attention than the other topic, while still being very crucial as it affects the very cost of healthcare as a whole. So let's start by explaining the various payment models, starting with the current traditional Medicare model. Now, with traditional Medicare, it goes by what they call a fee-for-service model. So basically, doctors make money when they provide you a service. This could be in the form of drug prescriptions, running tests on you, or really just a simple appointment. So every time you see a doctor, or a doctor is providing you a service, they need to write what is called a claim, and the more claims they write, the more money they make. Similar to a contractor, such as like a plumber or like an electrician. They provide a service to you, and the more pipes a plumber fixes, or the more electrical outlets an electrician fixes for you, the more money they make. Now, the problem we see with this is that theoretically, I'm not saying that doctors actually do this, but if a doctor wanted to pay off his student loans quickly and make a fat amount of money, they'd be incentivized to write as many claims as possible. This means unnecessary appointments, unnecessary drug prescriptions, unnecessary tests. Now again, I'm not saying that doctors actually do this, but what I am saying is that the system that we currently have would reward them and incentivizes them to do this if they sought as much money as possible, if they sought to earn more money. So then you have what is called Medicare Advantage, where you take this same fee-for-service model, but you add the ability to deny certain claims deemed unnecessary. The big question with this model is, where do you draw the line? What would be deemed medically necessary and what would be deemed otherwise? Also, how much more work would this put on doctors, nurses, and caseworkers to have to go through each and every claim? This would add a lot of bureaucratic paperwork into the mix. Now, don't get me wrong, it is definitely a way or solution to save money and reduce unnecessary costs associated with healthcare, but there are some questions that need to be asked. And lastly, we have what Andrew Yang is proposing, and that is the capitation model. No, not capitalization model. This ain't alphabet soup. Capitation model. Now, I'm gonna be honest here, I had no idea what capitation meant. I had to go look it up. But basically, it means you set a fixed amount of money a doctor can make from one patient. No more, no less. So first, I'm gonna try to explain this with a non-healthcare related example. So, y'all remember Blockbuster? They offered like a monthly movie subscription membership for 10 to 20 bucks, I think. I was kind of young back then. But point is, they offered this monthly movie subscription. So if you remember, regardless of how many times you went into Blockbuster to rent another movie, in that month, they would only be able to make $10 to $20, whatever it was, from you. No more, no less. With the exception of those, late movie fees, but that's besides the point. For the sake of simplicity, this is essentially what the capitation model does. Now compare that to a place like Walmart, where the more movies or the more items they sell you, the more money they make. Kind of like a fee-for-service model that we see in the current healthcare industry. So Yang's proposal for Medicare for all is to adopt this sort of subscription model, this capitation model, where doctors are paid a fixed amount per patient, let's say like each month, no more and no less. So within that month, for that one patient, a doctor can prescribe as many drugs as they want, to run as many tests as they want on that one patient, do as many appointments and see that patient as many times as they want, but they will still be making that same fixed amount off that one patient. No more, no less. On the flip side, a patient may only see the doctor like once or maybe not at all in that month, yet the doctor will still be making that fixed amount on that patient. No more, no less. I think y'all get the idea now. It's almost as if the doctor has a salary. And essentially, this changes the doctor's incentives from seeing the patient as many times, prescribing as many drugs, running as many tests on that one patient as possible in order to make more money, to really keeping the patient as healthy as possible and away from the doctors, right? Away from having frequent visits, which then allows doctors to more easily manage their schedules. And if they wanted to make more money, all they would have to do is take on more patients. But in order to take on more patients and keep their existing patients, they would have to provide their patients more preventative care to keep them healthy and away from the office, yet still in their like health insurance network. Which means for everyone else, better quality care, no unnecessary costs and waste with healthcare, and more trust in doctors. But don't take it from me, take it from an actual doctor, Z-Dog MD.
There's a million ways to do it, but focus on what works. Pay doctors to keep people well instead of just reacting when they're sick. You fix primary care, you actually improve the rest of it.
So that is the first topic, the fee-for-service model with traditional healthcare versus the improved, in my opinion, improved capitation model. Okay, so now that we got that out of the way, and we have a solution to reducing the costs and waste associated with the current healthcare system, let's talk about Andrew Yang's stance on the big question: public versus private. So from my understanding, Andrew Yang wants a super affordable public health insurance option for anyone to use, while still keeping private insurance companies for those that want to keep their private insurance. So the idea is that Andrew Yang wants to introduce this public option that's almost like another competitor in the healthcare industry, right? Like a super affordable competitor to the private insurance companies. And then over time, prove that the public option is a good and reputable option for the American people, so that over time people will then move to the public option. So private insurance companies will have no other choice than to, one, lower their prices, or two, get phased out like an actual free market economy. And the reason why he doesn't want to like abruptly eliminate private insurance companies is because he doesn't want to like reform and change 18% of the economy in the US, right? Quite frankly, he just doesn't think an abrupt change is realistic. And we have to keep in mind that there are still millions of people being employed by these health insurance companies. So the way he sees it, a transitional period is necessary. So essentially, for Andrew Yang's stance on the public versus private discussion, and I'm sorry if I didn't really hit on every single little thing, but essentially he wants a transitional period from what the healthcare industry is today to a majority public option, if not 100% public option. Whatever happens, it is determined by the free market economy. It's determined by people, rather than like just have mandating that the government just cut off all private insurance companies, or continue to have things as is. So now moving on to some miscellaneous topics about Andrew Yang's Medicare policy, because boy is it super long. He writes so much stuff about it. Check it out on his website. I'm gonna leave a link in the description below if you want to check it out yourself. Anyways, the first miscellaneous item is he wants to promote what's called holistic medicine. So on top of having like physical examinations and whatnot, he also wants like the availability of psychologists and like psychiatrists to see basically mental health experts more accessible to everyday people. Also like many people, he wants to get health insurance off the backs of employers. So, people are going to be free to actually open a business because healthcare is not going to be tied to their employment. And also from the employer perspective, they're going to be saving a lot of money from not having to pay health insurance for each and every employee, which means more profits for them that they can then reinvest into their business, or what else? Pay higher salaries for their employees. So with that said, hope y'all enjoyed this video and hope y'all have a better understanding of Andrew Yang's Medicare for All proposal. I must say this has to be one of the most rewarding videos I've made in a while, just because I know it's going to do a lot of y'all help out there in understanding the nuances of Medicare for All. And on top of that, a lot of research and planning was going on in the back end, so show your boys some love and support. Hit subscribe if you want to see more videos about college, career, and Andrew Yang, and I hope to see y'all in the next one.